Thank you very much for making this event a memorable one. The launch of the ECHAlliance ecosystem is a milestone for us in Nigeria, looking at the different thematic areas we can benefit on collaboration, growth, progressive discussions, and so much more. So presently we have discussed about problems, and Professor Sambo has given us the long metamorphosis of digital health. So now the next panel is for the TeleOncology Hub crew. Ma, I invite you. Thank you, Ma, to come on board. So I will be discussing with the Chief Medical Director of Federal Medical Center, Jalingo, and myself, Dr. Ayuba Hannatu Usman. All right. So, Mr. Andy. All right. We understand that cancer patients, stroke survivors in the Northeast and most parts of Nigeria face a lot of health inequities, cancer disparities, and we sought out to look for a solution. So we at Cancer Consciousness Initiative organized a model which we call the TeleOncology Hub. So I'm going to allow Dr. Aisha to give you an introduction while I'll cap it up.
Thank you, Dr. Hannatu. I'm happy to be here at the launch of the 7th ECHAlliance initiative. So, like she said, I'm Dr. Aisha, the MD of Federal Medical Center, Jalingo in Taraba State. So, Dr. Hannatu, my sister, when she completed her studies, I asked her to leave Abuja and come to Jalingo. So, of course, she tactically did not say yes or no, but kept on just talking and talking. So I now complained to her and I showed her the benefit of having an oncologist. We don't have a single oncologist in Taraba. So when I painted the picture to her, she listened attentively. I was hoping to convince her to come to Jalingo, but she now brought up this idea of a collaboration using technology. So she brought on board the CCI crew, the PPMD, that is Patient Pocket MD, that they are the technology providers, and then we in FMCJalingo. So we looked at the model she presented and we embraced it wholeheartedly. So we, as an institution, we were supposed to provide the infrastructure and then the human resource for the process to continue. Of course, we have the patients, that is the population. So based on that, a WhatsApp group was created, and we had already trained 3 oncology nurses. We don't have an oncologist. So we now co-opted other consultants from other disciplines, and they joined Dr. Hannatu to start the process. That is now is a 4-pronged process, and Dr. Hannatu, the CCI, PPMD, and of course, Federal Medical Center, Jalingo. So they started talking and the operations went on. Currently, as it is now, they have seen about 18 patients who hitherto would not have accessed care. Okay, they have broken barriers. The use of technology has now means that we can access people in underserved areas, in remote areas, just using technology. The cost of travels has been eliminated and so much. And now they can have access to specialists, oncologists, who can give them the best of care. They can also have access to donors who can help them in diagnostics and treatment. So you can see that it's a win-win situation for everybody. So this is the story, the little story of the TeleOncology Hub in Jalingo. We are currently on basics. The hospital has provided infrastructure in terms of accommodation for them, but it's still basics. The hospital has provided equipment, basic equipments for them, computers, and so on and so forth. However, the big ones like the CT scan, the MRI, and the PET scan, the brachytherapy I had, we don't still have them. However, the federal government has appropriated CT scan for us, 2025 budget. We are waiting for it. And the Northeast Development Corporation has also promised to give us an MRI. So we are also waiting for this. But we still need more tools to help in the diagnosis of cancer. The ones that we can assess, they have made provisions for transportation of sample and also linkage to care, so that these people, despite their economic status, can have access to comprehensive health care, so that their chances of cure can be improved. I think this is a little story of...
So this model we're talking about for TeleOncology Hub is a model that comprises telemedicine consultations. We are bringing access to underserved areas. These are people who have no hope of seeing oncologists or seeing the MDT, which we call the multidisciplinary team of specialists. So this our model comprises the MDT, that's the multidisciplinary team of different doctors, which we do video conferencing, and we follow the guidelines. We have our own clinical practice guidelines that we follow. So we also add patient navigation services. It has been very interesting bringing patients back to the clinic. You can have a very fantastic clinic with an oncologist waiting for patients, but if you don't break those barriers, which we have plenty of them, our patients have a lot of cancer disparities from the communities. There's logistic barriers to even the transportation to go to the hospital. There's the linguistic barrier, even the language to speak in the hospital. Some patients get very embarrassed and scared when they enter the hospital. Then we have many other barriers. We have fantastic oncology nurses that we've trained for the patient navigation, and these nurses and oncology, even some cancer survivors are on our patient navigation crew. So we're able to speak with patients online. Sometimes we do teleconferencing or video conferencing. They see us, we discuss with them, and this is how we are breaking barriers. So we at TeleOncology Hub, we are not just staying at Taraba alone. We are looking at expanding to other states, neighboring states, Adamawa, Gombe, Yobe. We are also involved in cancer advocacy. This cancer advocacy, we get to meet our elders who are going to support the renovation of telemedicine suits. And this, we've already kickstarted that for FMCJalingo. So we are calling out for collaborators, enablers, sponsors, and support to enable us scale up this health system strengthening initiative. The doctors in these facilities are all we are going to work with. We are now adding our specialist oncology services to their care. So we had to do a lot of relearning. We had to do a lot of awareness that we're not taking their work. We are just adding value to their work. Because presently, to manage a cancer patient, you need an MDT team to support your care. And that is what we are doing. And we are seeking out to collaborators, sponsors, not only in Nigeria, but all over the world, in all our ecosystems. We are looking at reaching out and seeing how we can bring oncology, specialized oncology care by bringing access to underserved communities. Thank you.
Wow, wow. Please, let's put our hands together for them. Like, I have so many questions, but I don't know if we have that luxury of time. We don't have time. But I would like to say this is really impressive. I see a hand up. I'll take his question or comment, then we would call it a session here. Thank you.
Thank you for this presentation. To the CMD or MD, whichever one. You've been promised CT. You've been promised MRI. When you make the diagnosis, what next? The treatment. And I like what you are doing, collaborating with Dr. Hannatu. Hannatu is from your state. Do the needful to bring somebody like her home. Just wait. There is nothing as bad as having a patient receiving underdosage of our drugs. Because some people will say because they are attending the MDT meeting, they can do it. No. From my experience, I've seen a lot of patients that are receiving that have received underdosage of their drugs before being referred. So even if you cannot grab her, but I've said, I believe you understand the language, do the needful. There are other younger colleagues, we are training them. No, and we are conscious that we don't have them available in the country. Our chief examiner beside me here, we are training them. Please encourage. You can do one or two things to bring those younger colleagues back to your state. You'll be amazed if I mention names now. Dr. Zachary, I believe, now in US, was in your state. Thank you, you know him. He was my student in Zaria. Look, we did a lot for him to get back home. But what happened? So please, I don't know, because you can have the CT, you can have the MRI, you have them, what next?
Thank you, sir. Okay, so we're going to take one from a Gen Z, I hope, and after that we'll just move to the next session.
Hello, good afternoon. I am Musa Usman Babagari, a 300 level student from Modibadama University, Yola. We are having in Modibadama University, we're having oncomicrobial research group. During last in World Cancer Day, we organized workshop for all the primary healthcare workers, and then we organize also free cancer to 5 primary healthcare in the Adamu state in collaborating with Modibadama teaching hospitals and primary healthcare agency. So I'm really overwhelmed because the person that organized that is my mentor, HOD of microbiology from Modibadama University, Dr. Zubaida Hassan. So I am really overwhelmed. I also will be happy to collaborate with her on this TeleOncology Hub. Thank you.
Wow, please let's put our hands together for him. These are the kind of conversations we need to have. Thank you. All right, thank you so much. Thank you.
Yes, honestly, I'm committed. I'm committed to having physical specialists within the facility. This teleoncology is a stopgap. It's something that we need to do because that is the only solution we have now. Because I've been trying to get Hannatu, to get her colleagues or her to come back, but it's not really results. And our patients are suffering. These 18 patients we treated will not have been assessed if not because of this teleoncology. So we're doing everything we can to make sure we strengthen TeleOncology Hub as well as bring back these young people. But I think I need to get your phone number. We need to converse. And of course, the master trainer, so that as these young ones are being trained, we can reach them to see how they can, just that this JAPA issue and the demands can be overwhelming sometimes. Funding is not there, but we would make sure that we do all what we can to make sure that we bring in these young ones to Jalingo. The whole of Northeast, we have only 2 oncologists, as stated by my brother here, Dr. Professor Ali Gombe. So you can see it's a Northeastern issue. So thank you so much.
Thank you so much. Thank you so much, ma'am.